when we started in 1975, it was really under pressure from some of our patients. My partner, Al Visor, had a friend of his called Elliot Birch, and Elliot, he had a lab at Harvard. Albert went up, he said, "Elliot, what would it cost for you to come to Dallas with us?" He said $4 million, and that kind of ended the discussion. All I can say is that I'm kind of glad that Elliot Birch never came here. We saved $4 million and we got a whole hell of a lot more.
The foundation started in the basement of Presbyterian Hospital. It was a fledgling organization. David and Eileen Birch came down from Boston after they had finished their training and postdoctoral fellowships. They took a chance.
They came in and they didn't realize what they were taking on. So that's pretty helpful sometimes.
And David is, above all, a scientist. And he's been a great leader in the field of retinitis pigmentosa.
He did so much work with electroretinography early on. And then he developed the multifocal ERG. He just went on, and then from there got into the genetics of it all.
We've seen research develop at the bench in the lab and now being applied to the treatment of patients at the bedside. David is also a clinician PhD, which is a little bit of an unusual position because most PhDs like to hide their head in the labs.
I was referred to the Retina Foundation. My symptoms were of one of the diseases that was being studied. And after Dr. Birch told me what was wrong, he said, "Look, the research we're doing here and around the world is amazing. There will be some sort of treatment or cure. It's not hopeless." I've learned since then that some medical doctors don't know what to say. They'll tell you to go home and learn Braille. He's one of the brightest, hopeful men I've ever met.
I ended up having RP, retinitis pigmentosa. My eye doctor never picked it up. From day one, David gave us so much hope and encouragement.
He really gave us a lot of comfort that he had command of what retinitis pigmentosa was. It just gave us a tremendous amount of confidence that we were at the right place, and we were. I just can't tell you how important it's been to our community to have the Retina Foundation grow in the right way, with the right ethics, the right people, and the right mission statement. It's been everything, and it's all been because of David's leadership.
I've known Dr. Birch for quite a long time. It became clear to me immediately that David was a unique individual. Not only was he incredibly well-read, experienced, highly intelligent, but what I think really struck me was his overarching compassion and dedication to his patients. He was dealing with patients who at that time had incurable retinal degenerations, and he was doing all he could to unravel the mysteries of their disease. Part of what also drives him is sharing that knowledge with people around him, ensuring that the next generation of people know as much, hopefully more than we do, is part and built into the fabric of the Retina Foundation because of David and his personality.
You know, David has not only written all these papers, but also has trained a number of people. One of them is Mark Panisi, who's a world-class geneticist.
David built an amazing team. We have employees who stay here because they really love what they do and they see the effect that we're having. My vision is very simple. There are over 300 different genes that can cause inherited retinal degenerations. I want to find treatments for every single one of them.
About a year and a half ago, our 24-year-old son, Evan, started having issues with his vision, CRB1-related macular dystrophy.
The week following was pretty devastating. There's no hope, like it's over. Within minutes of Dr. Choi giving me the diagnosis, he recommended Dr. Panisi and the foundation, and pretty quickly after that it shifted to, all right, let's do this.
Oh, Rochelle. I'm glad that you're here. He sees Dr. Mark as well.
Are you seeing Dr. Panisi?
Yes,
all right.
Thank you for having us. This is all just, we flew here just for this.
There's not a doubt in my mind that they'll find a cure. I know he's learned from the best.
When you go to medical school, it's very easy to read about the diseases in the textbook, but you don't really learn what it means to the patient until you see the patient and talk to them and listen to their hardships.
The future is incredibly exciting because we are on the cusp of figuring out how best to correct these gene defects that David was so instrumental in identifying.
We've gotten gene therapies approved. We have many more gene therapies on the way. We're starting to do clinical trials with stem cells to restore vision. We used to have to say, well, there's nothing we can do. Now we say, well, you have to pick between these two different trials. And that's really a good problem to have.
All the efforts in personalized medicine, being able to splice genes and even implant them, that's the future.
The trajectory of the research that's been done, some patients are able to be cured with one genetic treatment. That's astounding.
If your dreams don't scare you, you don't dream big enough. We've gone through an enormous transformation over the last 2 or 3 years that is setting us up for further growth and further ability to help patients.
We need more clinicians, we need more scientists, we need more technicians. Well, I'd say we're going to build a team like the 1993 Dallas Cowboys with all the best players and go to the Super Bowl.
One thing that I've never heard David tell anybody is there's nothing else we can do. There's always something we can do for somebody. And there really is no other place in the country, and perhaps even the world, that has the opportunities that we have going into the future.